Hi, everybody. This is Dr. Lorn Allison, and this is a follow-up to the previous podcast about using frequency wavelengths to heal infections. And this is actually a case study for using frequencies to heal H. pylori. This is just one example of which in my clinic we now have many examples. We had a young girl, the age of 20, who was brought to the office by her mother. And in the previous month to her visit, this young woman was virtually unable to eat anything without throwing up afterwards. Now, she was brought in on break off of college. And as you can imagine, trying to get through a college curriculum, especially in the last year, and having massive digestive issues was not a workable situation. So not only was she not able to eat anything without throwing up, but now it was extending to liquids. So she was actually having problems with water. And I realize a lot of people don't quite understand how that's possible, but it is possible. Eating had become very discouraging, as you can imagine, and she was cut down to pretty much all foods where there really wasn't anything she could eat. I mean, she had some tricks that were allowing her to get a little bit of food in, but a good chunk of it was coming right back up again, probably 99%, at least from her account. And now the smell of food, in addition, was making her extremely nauseous, occasionally with dry heaving. Now, she had started taking an anti-infective supplement or multiple supplements, but she obviously could not keep those down either. She was vomiting those up, and she had preferred not to use antibiotics because she had used them in the past for a gut infection, not the same type of gut infection, but she had severe abdominal pain during and after using and finishing those antibiotics. And that went on for weeks post protocol with the antibiotics. So she was very leery of trying to find an antibiotic that would work, let alone she really didn't have a solid diagnosis. So with all this in mind and based on her symptoms, the first thing that I assumed was that she had an H. pylori infection. I ordered a stool test to check for H. pylori and other types of infectious agents such as parasites, including Shigella, Cryptosporidium, and markers for antibiotic resistance. And what that means is that you're checking for her system's susceptibility to using certain antibiotics and actually getting progress. Now, we continued with the plan assuming that the infection was present until we received results. When I was going through her history and we found that while she was at school, there was good access to fairly decent food choices that included salads and fresh vegetables, fresh fruit choices, certain meats, animal proteins that were fairly clean and not heavily processed, as you might imagine in a typical school environment. Now, before this issue, and while she was eating normally, she had no particular problems with any specific foods, implying that no particular foods might be causing the current problem, and it was just some sensitivity or an allergy or a combination reaction to certain food choices. So based on those symptoms and her desire to avoid antibiotics and the fact that she couldn't even take natural anti-infectant supplements, this was a case where I decided it might be a good idea to use frequencies to possibly treat for the infection because we really didn't have alternatives at that point. Now, I had run the first treatment of codes in the office for 1.5 hours and then had her come back in 2 days for a second treatment of 1.5 hours. And when she returned after the first treatment, she remarked that she was at least 50% better. After the second treatment, she reported feeling at least 80% improvement. Now, during this time, the stool test that we did for H. pylori came back positive, so we knew we had the right treatment plan. Now, after the third treatment of 1.5 hours, she was actually symptom-free. Now, since she was going to be returning to college, her mother was concerned that the symptoms might return, and since I had not been treating with frequencies on a regular basis more than a few times, I wasn't exactly or entirely confident myself her symptoms wouldn't return. So I agreed with the mother to treat her 2 more times for 1.5 hours each. Meanwhile, we had done a second test for H. pylori. And so the second test for H. pylori came back and we found it was negative. So the infection had been removed purely with frequency treatment after after only 3 1.5-hour sessions, which is very interesting and was very poignant for me because since that particular case, I have done many of these using frequency alone. So that was quite the wake-up call for me. Now, at 2 weeks after her first visit, she was actually feeling pretty good and starting to eat more and getting her strength back. And she didn't seem to be having negative reactions to her foods. So now it was time for her to go back to college. 2 years later, her mother came back to the office for a different reason and remarked that they still couldn't believe how effective that type of treatment was for an infection. And I had to agree, except now I've had so many cases where I've seen this work that it almost seemed unremarkable. Although I still am fascinated by the fact that it works, considering I also have somewhat of a traditional medical education, and this was not something that was supposed to be, or at least considered, possible. When I think about how there seems to be so much more to healing than we know, I'm comforted by it, I'm fascinated by it, and there's a certain amount of urgency, which is why I'm putting this podcast out. Even though for most of us who do this type of work, you would be very hesitant, as I had said in the previous podcast, only because it can draw a lot of unwanted attention. But at this point in my career and in my clinic and writing, I feel that the responsibility of knowing and seeing, and not only that, but having the data behind it, the fact that so many people are suffering from things that standard treatments don't always work for or are effective for, and that there are things that are at least options to try. And regardless of the ire that you may draw from either certain people or professionals or institutions, the fact is that this stuff is out there and it works. It is being used more and more readily, and you're hearing more and more about it, and eventually it will likely be mainstream, and the time has come. And I think that most of us, even though we always considered it very taboo to talk about these things, even though every practitioner knows either at least another practitioner or someone who's doing this avant-garde type of work and getting really good results with it. It doesn't mean that it is always the best for everyone. It just means that it is another option and that doesn't cause harm and may very well help someone who is unable to be helped in another way. So I hope that this information reaches that person who can't be helped any other way, and potentially they find a practitioner or a clinic where they can do this type of work and they're open to using these types of therapies so that they can get improvement. The limits we have in our beliefs, not only individually but institutionally, can keep us from seeing the truth, even though sometimes it's right in front of us. And I think culturally, medically, that there are dramatic changes occurring now. This is a great time to be alive. This is a great time to make the most out of what your potential is. Simple things like treating infections that could 100 years ago end someone's life. Now they can be treated sometimes in a matter of hours, and a person can go on and live and do the things that are important to them. Wishing you the best in health. This is Dr. Lorn Allison with masterthebody.com. Thanks for listening.